I am Dr. Ravi. Today I am discussing about the circle of Willis. The circle of Willis is also called the circular arteriosus. The circle of Willis, it is an arterial circle which is formed by the branches of the internal carotid and the vertebral arteries. The circle of Willis is an arterial anastomotic circle present in the interpeduncular fossa extending between the superior border of the pons and the longitudinal fissure. It is a polygonal arrangement. It is a polygonal arrangement of artery that is formed by the posterior cerebral, the posterior communicating, the anterior cerebral and the anterior communicating arteries. These four arteries, the posterior cerebral, the posterior communicating, anterior cerebral and anterior communicating artery, formed the circle of Willis. The figure showing the circle of Willis. The two branch, the internal carotid artery, the branches of the internal carotid artery, the anterior cerebral, the middle cerebral and the posterior communicating artery that forms the circle of Willis. And the anterior communicating artery, it is formed by the communication of the anterior cerebral artery. The two anterior cerebral artery communicate with each other by the anterior communicating artery. And the circular arteriosus, it is bounded posteriorly by the two posterior cerebral arteries. These are the two posterior cerebral arteries. And the two posterior cerebral artery that communicate with the middle cerebral artery on each side by the posterior communicating artery. These are the posterior communicating artery that communicate with the middle cerebral artery. Anteriorly, the two anterior cerebral artery communicate with each other through the anterior communicating artery. The circle of Willis give origin to many central branches, and these artery arises in the four groups: the anterolateral group, the posterolateral group, and the anteromedial group and the posteromedial group. These branches immediately pierce the surface of the brain, mostly through anterior and posterior perforating branches to supply its internal part like the corpus stratum, the thalamus, the internal capsule and midbrain. And these arteries do not anastomose significantly within the brain substance. And these arteries act as an end artery, and damage to the branches entering the substance of the brain leads to destruction of the brain tissue. Artery involved in the circle of Willis act as an end artery, and damage of these artery leads to destruction of the brain tissue. Now, what is the significance of the circle of Willis? These arterial anastomosis act as a route through which the blood entering the internal carotid artery or the basilar artery may be distributed to any part of the cerebral hemisphere. And if one of the major artery forming the circle of Willis is blocked, then these arterial anastomosis provide an alternative route through which the blood can be supplied to the area of the blocked artery. And next is the aneurysms. Aneurysms are abnormal saccular dilatation of the large artery at the base of the brain in the circle of Willis. An aneurysm artery rupture or leak leading to bleeding inside the subarachnoid space. Thank you. This is all about the circle of Willis.